Ever pondered over the most common emergency drugs used in hospitals and their uses? Well, the assortment of emergency drugs varies depending on the nature of the emergency and the hospital's protocols. However, there are some common emergency drugs that are universally recognized and used. First up is epinephrine. This miracle drug is used to treat severe allergic reactions known as anaphylaxis, asthma attacks, and even cardiac arrest. Its ability to constrict blood vessels and open up airways makes it a lifesaver in emergency situations. Next, we have atropine. This drug is administered to treat symptomatic bradycardia, a condition where the heart rate is slower than normal. It's also used for organophosphate poisoning and to reduce secretions before surgery. Third on our list is adenosine. This drug is used in the treatment of supraventricular tachycardia, a condition where the heart beats abnormally fast. Adenosine works by restoring the normal rhythm of the heart. Naloxone is another commonly used emergency drug. It reverses the effects of opioid overdose by blocking the opioid receptors in the brain, effectively bringing the individual back from the brink of a potentially fatal overdose. Then there's aspirin, a drug that is given during suspected heart attacks. It works by reducing blood clot formation and preventing further blockage of blood vessels, thereby minimizing damage to the heart. Nitroglycerin is another drug used in heart-related emergencies. It dilates blood vessels to improve blood flow and relieve chest pain associated with conditions like angina or heart attacks. Diazepam, also known as Valium, is administered to control seizures, manage alcohol withdrawal symptoms, and for sedation during certain medical procedures. Moving on, we have glucose, a simple sugar used to treat hypoglycemia or low blood sugar in diabetic emergencies. Albuterol, a bronchodilator, is used to relieve acute asthma symptoms and treat bronchospasm in conditions like chronic obstructive pulmonary disease. Lastly, lidocaine, an antiarrhythmic medication, is used to treat ventricular arrhythmias and stabilize the heart's electrical activity. Remember, these drugs are typically administered by trained medical professionals following established protocols and guidelines. The choice of drug and its dosage are determined based on the patient's condition and medical history. To recap, emergency drugs are a crucial component in the management of medical emergencies. From epinephrine for allergic reactions and cardiac arrest, atropine for slow heart rate, adenosine for rapid heart rate, naloxone for opioid overdose, to aspirin and nitroglycerin for heart attacks, diazepam for seizures, glucose for low blood sugar, albuterol for respiratory problems, and lidocaine for heart rhythm disturbances. These drugs can often mean the difference between life and death in critical situations.